I so much love the fact that people have come to understand and accept cesarean section, commonly called CS, as a method of birthing a child. Gone are the days when women who give birth through CS were treated as outcasts, most especially coming from their fellow women. They were bullied, they were tagged lazy, and they were called all sorts of names, ignorant of the fact that CS is another method of birthing a child. There are two different ways you can birth a child, vaginally or through cesarean section. Cesarean section is a lifesaver and not a death sentence as many people used to think. I remember way back when I went to give birth to one of my child, I was battling in my own labor pains. Then this woman came in, she was brought in, she came in with her mom. She was induced, and then at some point her labor was no longer progressing, so the doctor recommended cesarean section. I didn't even know that a cesarean section was recommended for her, not until I heard this woman's mom crying, wailing, lamenting, screaming, disturbing the whole of the hospital, that she doesn't want her daughter to undergo cesarean section. What will people think of her? What will people say? That people will laugh at her, people will mock at her. God should not allow this to happen. She was just talking and talking. In my mind, I was like, shoo, in this time and era, I also know of women who, out of stubbornness, yes, I call it stubbornness, because how can your doctor, who knows what is best for you, recommend cesarean section for you, and you, out of stubbornness, refuse that you don't want to go undergo cesarean section because of your faith or because of what people will say or think about you? Some is even coming from their family members. Giving birth like the Hebrew women does not only mean giving birth vaginally, it also applies to CS more. So why endanger your life? At the end of the day, what matters is you having a healthy baby and for you and your baby to come out alive. That is the most important thing. In today's video, we are going to take a look at some of the reasons why cesarean sections are performed. Caesarean section, commonly called CS, is a surgical procedure to deliver a child through an incision in the woman's abdomen and uterus. It is of two types. We have the elective caesarean section. We also have the emergency caesarean section. The elective caesarean section is a planned caesarean section. Yes, it is usually planned in advance. That's why sometimes you hear a woman will tell you that I've been booked for CS on so day. She already know that she is undergoing a cesarean section because it has already been planned. That is elective, and it is done for so many reasons. Like number one, it is done when the woman is having a large baby. When the scan shows that the weight of the baby is much, that the woman may not be able to push on her own, a cesarean section is recommended. Number two, when the woman is having multiple babies like twins, triplets, quadruplets, and the likes, a CS is also recommended. Number three, breech presentation. When the presentation of the baby is feet first or buttock first, and the baby cannot be turned, a cesarean section is recommended. Number four, maternal health conditions such as high blood pressure, diabetes, or sexually transmitted infections such as HIV, which could be passed to the baby during delivery. A cesarean section may also be recommended for that. Number five, placenta previa. When the placenta blocks the birth canal, yes, when it blocks the cervix, putting the life of the baby in distress, a cesarean section is also recommended. Women who previously have CS or other uterine surgeries are likely to also undergo cesarean section. This is because if they are allowed to give birth vaginally, it may put them at some kind of risk. And then number seven, maternal request. Yes, this one is non-medical. The woman on her own decides that I don't want to experience labor pain, so I prefer to just go with CS. On their own, they opt for CS. There are also women who feel like they want to control the birth date of their children, so they opt for CS. We also have emergency cesarean section. Just like the name implies, it is emergency. This is unplanned. It is usually not planned, unlike the elective cesarean section. It is done when there is complication during labor. Yes, when there is a threat to the life of the mother and her baby during labor. And it could be done for the following reasons. Fetal distress, when the fetus is in distress, like the baby's heart rate drops too low, or other signs that shows that the baby is in distress, the baby is not getting enough oxygen, then an emergency cesarean section may be carried out. And also, number two, when the woman is having a prolonged labor, when the labor is no longer progressing or is not progressing normally, a CS may be recommended, an emergency CS may be recommended. We also have placenta abruption, a situation whereby the placenta separates from the wall of the uterus too soon, putting the life of the baby at a risk of not getting enough oxygen. An emergency CS will be recommended. And then finally, prolapsed umbilical cord, a situation whereby the umbilical cord comes out before the baby, cutting off oxygen supply from the baby, putting the baby at risk. So these are some of the reasons why a woman may undergo cesarean section. Like I said earlier, cesarean section is a lifesaver and not a death sentence. If you find this video helpful, kindly give it a like. Don't forget to also share with your loved ones. If you're yet to subscribe to this channel, well, I don't know what you are waiting for. To my beautiful and amazing subscribers, you guys are the best. I love you all. I'll see you in my next video. Until then, it's bye.